Health Coach, Volunteer Training Program Part 3, Relationship Building and Empathy. In Part 2, you learned about the vital role that health coaches can play in spending time with patients so that patients can develop goals that fit in the context of their lives and lead to important and meaningful changes in their health. In this lesson, you're going to learn some of the specific skills that will help you relate to patients.
Okay, my name is Rachel Martikovich, and in this module, I'm going to be talking to you a little bit about relationship building skills and empathy. Now, one important thing to remember is that when doing interventions around behavioral health change, the relationship between either the doctor and the patient or the counselor and the patient is one of the most important factors to whether or not the intervention is going to be successful. It is an essential catalyst in behavioral interventions and is really one of the most important factors when predicting behavioral health change. So some important things to remember is that empathy is a very necessary component when you're going to be working with these patients. It's always considered to be necessary to facilitate change, and there are some core conditions of empathy that I'm going to review with you just to give you more of an idea of how you should be interacting with these patients. One of the most important things is to really convey that you're understanding where the patient is coming from, and you're displaying an understanding of that patient's life experiences and of the way that they're thinking about the world and the way they think about themselves. You also want to be sure that you're being authentic when you're with the patients. You're not really in there just playing a role or being artificial, running through a bullet point of questions. You really want to be authentic and convey that you're really listening to them during these interactions. It's also very important to be non-judgmental and really accepting of what the patient is telling you. Again, you have to remember that they're the experts on their own lives, and it's really important to kind of come alongside with them and not judge them or not kind of scold them or blame them for things that haven't gone right in the past. You just really want to be accepting of where they're at and understand that they're the experts on their own lives. And again, it's very important to kind of create this atmosphere of openness and trust and really be, in a collaborative role with the patient. You're not coming in and kind of playing an expert role or lecturing them or kind of giving them advice and telling them what to do. You really want to just kind of be there to facilitate their, going through the process of change and figuring out what they want, what their goals are, and, really how they're going to try and complete those. So, how do we develop empathy with patients? One way to start out is to, make sure that you're using attending behaviors while you're there with the patient. Things like making eye contact with the patient is very important. You want to make sure you're self-aware of, your pace of speech, make sure you're not talking too quickly, and, keep a good tone while you're interacting with the patients. You want to keep your body position open, possibly lean in when the patient is talking. Really show that you're there with them, listening to them. Also, hand gestures, head movements, furthering responses, kind of like, yes, tell me more while they're talking are always great to keep the patient talking. You want to smile, and also, be sure to mirror the patient's emotional responses. Obviously you don't want to be smiling if they're telling you something very upsetting or something that's really stressing them out. So be sure to just kind of be aware of, how you're reacting to what the patient is saying. And, talking more about creating empathy, some ways that you can kind of work on that is using relationship building and communication skills. So I'll go over 3 skills with you that you can use while you're interacting with the patients that will really help you to, build this relationship and further develop, what's going on in the interaction. The first skill I will review is a simple reflection. Now this is just basically restating what the patient has said in your own words. So you're kind of just conveying that, you're there with the patient, you're listening to them, and you've heard them. And a lot of the times when you make these simple reflections, it will encourage the patient to continue talking and kind of elaborate a little bit more on what they're talking about. Another type of reflection, which is the second communication skill we're going to review, is a complex reflection. Now, these are like simple reflections, but in a way you're kind of taking it a step further. These are statements that are reflecting back almost your own interpretation of what the patient's underlying emotions, values, or beliefs are. So you're kind of adding a little bit of meaning to the reflection. An example of this would be, if a patient says to you something like, I've been really trying to lose weight, but, I come home, I'm stressed out, I have a million things to do, I have to take care of the kids, try and make meals for everyone, get them to do their homework, and it's just really been a lot for me to handle. And you could say a complex reflection back, something like, it sounds like you're really overwhelmed and, you just don't know where to go from here and it's really starting to upset you. So you're kind of, conveying that you listened to what the patient said, but you're also kind of adding in a reflection on what the patient meant and what their, core emotions are in that statement. And a third skill that you can use when you're talking with the patients is to make kind of an empathic summary. So, after you've been talking with the patient for a few minutes and the patient's been telling you things, it's really great to kind of just wrap up, all the things the patient has been saying and kind of present it back to them, just to kind of give them a picture of, what you've been talking about and kind of, where you're at. So you're kind of pulling relevant pieces from the interview into a summary. You're incorporating, feeling statements the patient may have said or, just general content of what the patient is saying. And then you just kind of summarize that and give it back to them, just to show that you've really been listening. And this is also a great point if you want to transition into something else. You can kind of do a summary and then move on to another section. And again, using reflective listening is just really helpful because when you reflect back something that a patient is saying, that gives them a chance to kind of create a little bit more insight about what they really meant and kind of self-reflect and maybe, develop that thought a little further. Because, it's probably that patients are thinking these things, but to actually hear someone else say it back to them is very powerful and can really get them to, think about it further and on a deeper level and just really get them to start thinking about, making these changes or things going on in their lives and how that's affecting making changes. And again, also by doing reflections and summaries, you're encouraging the patient to do more of the work and to talk more. So it's actually a little bit easier on the health coach to use these reflections as opposed to just asking, closed-ended questions over and over again and getting back one-word responses. These reflections will really encourage the patient to kind of elaborate and go a little bit deeper and provide a deeper meaning.
In summary, the relationship that you and your patient develop is an essential element for behavior change. Empathy is a core component of this relationship. You as a coach can express empathy both by verbal and nonverbal communication. Reflection and empathic summaries are skills you'll learn to build a relationship and promote behavior change. Thank you.